Hi, everybody. Welcome to the first free webinar in a series. And this one is called How Do I Use CBD? I am Michelle Valley. I'm a family nurse practitioner, and I will be presenting this hot topic to you. We will have monthly webinars on different topics in the cannabis realm, and it's based on the frequently asked questions we get from our patients. If you have any suggestions on topics that you would like to learn more about, please reach out to us. My contact information is going to be on the next slide. So, I am Michelle Valley. I'm a family nurse practitioner. I'm also a certified cannabis practitioner. I started a private primary care practice called Advanced Telemedicine. We service Connecticut at this time, and we became cannabis specialists based off of the requests we were getting from our patients. They were asking us for alternative treatments to a lot of the common conditions that we see, and as an alternative to the common problems that we also see with the traditional prescriptions that we are given in this country. So, we are proud to support our patients in this way. In order to better serve our patients, I did get an additional certification to become a cannabis practitioner. Right now, it's not standardized, the training that medical professionals have regarding cannabis. So, if this is something that you are interested in for yourself, ask the background of the provider that you're speaking with, what their experience with cannabis is, what their knowledge is, and maybe seek out someone who has additional training to best give you the guidance, advice, evidence based research that you need to get the most out of this type of treatment. Okay, so this is going to be a great presentation that hopefully will answer many of the questions that you may have thought in your own head. What even is CBD? Where does it come from? How does it work? How do I even use it? And where can I get it from? Those are all the common questions that I hear from patients, and we will be taking a look into it more deeper here. Let's start by saying cannabis is a great type of therapy or medication. It's non-addictant, meaning if you stop using it, your body will not go through any kind of withdrawal. It's overall very safe and has very few interactions with any other types of medications or medical conditions. So we're going to start with a quote. Simply put, and politics aside, marijuana is the single most medicinally valuable plant that has ever existed. This was quoted by a doctor who went on to write a book called CBD, A Patient's Guide to Medicinal Cannabis. If you click the link here, it'll bring you to Amazon. You can purchase this book. At the end of the presentation, I also have a slide with a list of available resources that I recommend to also help you expand your knowledge on this type of therapy. So, cannabis has many cannabinoids. That's parts to the plant. There's two that have been studied the most and that we know the most about. And one of them is CBD, which stands for cannabidiol, and the other is THC, which stands for delta 9 tetrahydrocannabinol. If you can say that fast and confidently, you'll sound great. Not an easy word. That's why we call it THC. So, CBD, it won't give you a buzz, it won't get you high. Whereas THC is kind of the famous part of the plant when people think of, oh, I used weed, I used marijuana, that does cross the blood brain barrier and does give you that euphoric, impaired high feeling. In this presentation, we're not going to be talking too much about THC. Uh, that will be in future presentations, we'll focus more on that. This part is focused more on CBD. As you can see here, I did list some benefits that THC is known for. It can help reduce pain, it can control muscle spasms, it can help with appetite, and it also can help with nausea. I did not list the benefits of CBD because there's actually just too many to list. CBD can affect every system in your body and have some amazing effects. So, when I talk about the systems in your body, what exactly does CBD bind to, or how does it work? So, our bodies have a system in it called the endocannabinoid system. We have a respiratory system that helps us breathe. We have a cardiovascular system that makes our heart beat. And we have an endocannabinoid system that is responsible basically for our homeostasis, how we respond to stress, inflammation, anxiety, sleep, temperature control. That's all controlled in the endocannabinoid system. The crazy part is it was only discovered in the 90s, not that long ago, by a doctor who is nicknamed the grandfather of cannabis science. One of the reasons why it took so long to be discovered is because of all of the barriers put in place by politics and laws that restricted scientists from having access to cannabis and being able to study it. Now that we're realizing all of the medicinal benefits of the plant and more research is being allowed to be done, we are just discovering more and more benefits every day. So we have the endocannabinoid system in our body, and it's all receptors. And when we consume CBD, that binds to those receptors. And if all of those receptors are full, that gives our body balance. When those receptors are not full or out of balance, that's when we see different chronic conditions, symptoms, just not feeling well. So in this picture, you can see all the different cell receptors that use CBD, and they're located all over the body, from the deepest parts of the brain to the deepest parts of the gut to the surface of the skin. This means that CBD can be consumed in a variety of ways. One of the reasons why we see so many CBD infused products these days, you can take it in gummy form to get to that part of the gut. You can take it in cream form to reach the skin. You can inhale it, you could smoke it. There's tablets, all different ways to use it and different ways to get it to the different parts of your body that you're trying to get it to. There are two different CB receptors, CB1, CB2. CBD does bind with both of them, but it just shows you that in the body, between the two, it pretty much covers everything. CB1 is abundant in the central nervous system, in our connective tissue, our glands, certain organs, including the brain. CB2 is mostly part of our immune system. It's also in our gastrointestinal system, which we know is also very closely linked to our immune system. And it's also part of our nervous system. So this just breaks it down a little bit more. So we hear the term cannabis, we hear the term hemp, we hear the term marijuana. They're all kind of thrown around. What actually are they? So cannabis is the species of the plant, and it's broken down into different types. There is the marijuana plant, that it has higher levels of THC. It also has CBD in it, but it's got the highest level of THC. Hemp has lower levels of THC, does have some in it, but it is very high in CBD. So when you see products advertised, hemp derived, hemp farmers, CBD, that is great products. Oftentimes I hear, oh, it's just hemp, it's not marijuana, it's not cannabis. Again, they're all related, just the different types of plants have different components to it. So I like this because it just kind of narrows down, summarizes the highlights of the differences. So it's CBD, it's non intoxicating, it does not cross the blood brain barrier, it does not cause any kind of impairment. It's available everywhere now. I'm sure you probably have seen it, probably tried it, bought it. It's available in gas stations, airports, convenience stores, the CBD store, beautiful stores, all over the place. In order to be sold, it can have a little bit of THC in it because, again, that's part of the plant, but it needs to be less than 0.3% THC to be sold legally. And again, it primarily comes from the hemp plant. THC is intoxicating. It does cross the blood-brain barrier. It does give us a high feeling. It's only available legally through dispensaries. In Connecticut, where again I practice, it's available now at a recreational dispensary and a medical dispensary. There's usually 0.3% THC or more in order to be considered illegal or sold in a dispensary, and it primarily comes from the marijuana plants. I do want to say that at this time, each state can develop their own laws. So if you are going to be traveling, I would recommend that you look at the state that you're traveling to's laws before you go there. There may be some differences, and you have to follow the laws of where you physically are. So, Connecticut, you can buy up to 5 ounces per month as a medical patient right now from a medical dispensary. If you go somewhere else, you may only be able to carry up to 2 ounces. And if you're used to carrying up to 5 ounces from being in Connecticut and you're carrying up to 5 ounces in a state that only allows up to 2 ounces, you could potentially get in trouble. So every state has a website. Connecticut's is CTMMP, Connecticut, or it stands for Connecticut Medical Marijuana Program, ctmmp.gov. So wherever you go, you want to make sure that the website ends in .gov. That means it's a government website, so it's legit. It's the state's website, and they should have all the laws listed for that state. So to summarize what we've kind of talked about so far, the active compounds in hemp and cannabis are called cannabinoids. So again, we're just talking about CBD and I mentioned the THC, but there's lots of other cannabinoids that are just being discovered and we're learning more about. CBD is one of these cannabinoids. Human beings and many other living creatures have natural body systems called the endocannabinoid system within our bodies that use CBD. And CBD is non euphoric, just meaning it's non impairing. Non euphoric makes it sound not fun. But when you use it consistently and feel better, you will be having fun because it feels good to feel good. So now the $1,000,000 question, which brought you guys probably here tonight, is okay, I know everyone's saying it's so good. So where do I get it? How do I use it? So let's start by how do I use it? There's many different ways of using it. As I had mentioned earlier, you can use it in cream form, you can drink it, you can eat it, you could smoke it. You'll see CBD everywhere. And there's no wrong way to consume it. For people that are kind of just starting out, looking to try to see if it's going to be something that helps them, one of the better ways that I counsel people on how to start is simply by buying oil form of CBD. I do recommend getting it from a dispensary. And why I recommend that, I'm going to talk about in the next slide. But get a good product that you know is what the label says it is. And I think of it as a daily vitamin. I recommend using it every single day consistently for the max benefits. So you're going to purchase the CBD oil from a dispensary, and they're going to tell you what the starting dose is. The tricky part with cannabis therapy is there is not a one size fits all for everybody. It's not like our traditional pharmaceutical medicine where it's 325 milligrams per Tylenol will get rid of your headache. It's not like that because the CBD binds to our CBD receptors in our endocannabinoid system. So, depending on how depleted you are, depends on how much you're going to need. I may need less than my neighbor. So, you have to figure out your dose. The other thing with CBD is like any vitamin, once those receptors are binded, your body is going to excrete out the rest that it doesn't need, the extra, pee it out basically. So, it's impossible to overdose on CBD. So that's a really good thing to know. So you can't get hurt by taking too much, but anyone who's bought CBD knows that it's not cheap. So what happens when you take too much is you excrete out what you don't need, but it's a waste. So you want to figure out that right dose that's going to give you max benefits and not waste money. So ask the pharmacist or who you're buying it from what the starting dose is. Typically, it's 1 dropper full in this example. I am referencing a research article that I read that said typically it's about 3 weeks to get maximum benefits from CBD. So start with your starting dose, 1 dropper full for 3 weeks and maybe even keep a journal. You could see there's a link here to a complimentary journal that I put together to kind of help trigger some of the things that you should be looking out for. So please feel free to use it. Also, this presentation is available for download, so I will include that link as well. So you do your 1 dropper full, your starting dose for 3 weeks. At the end of 3 weeks, you should look back. You may wonder, did it do anything? Again, it's not going to be obvious like THC, but you should hopefully realize, wow, I slept better this past 3 weeks. I yelled at the kids less. I needed less Tylenol. You should notice subtle differences. And that's a good thing. And that means it's working, it's getting your body more balanced. At the end of 3 weeks, you're going to then try doubling the dose. So now instead of 1 dropper, take 2 droppers. It doesn't matter if you take it in the morning or the night. The more important thing is consistency. So if you keep it near your toothbrush and remember to use it every morning, that's great. If you feel like it makes you groggy, tired, it really shouldn't, but some people are sensitive, then I suggest taking it at night. So then you kind of sleep through that part and you'll wake up feeling good. So now you've doubled the dose for 3 more weeks. See how you feel at the end. If you say, wow, I feel even better, triple the dose. Now you're taking on weeks 6, 7, 8. Now you're taking 3 dropper fulls. Eventually, you're going to look back and say, okay, I really noticed no difference between 3 dropper fulls and 4 dropper fulls, for example. So then go back to the 3 dropper fulls, and that seemed to be the dose that gave you the max benefits. So now, where do I get the good stuff from? Currently, CBD products are not FDA approved. So there's no federal governing board that is checking to see if the product in the bottle is actually matching the product that the information on the label. So there may be some companies out there that aren't as accurate. They're kind of estimating what's in the bottle versus what's on the label. It's not necessarily that there's anything out there that would hurt you. It's just that it may not be as pure as they're saying it is and that you think you're paying for. So you have to be a little bit um, leery of just getting it from anywhere. If you do get it from an outside source, not a dispensary, I would just make sure that you learn about the company, their values. You will know a reputable company if you do a little research. The dispensaries, though, they require a certificate of analysis, a COA, on any product that's sold out of the dispensary. That means that these products had to go through a chemical testing process to verify that the product is actually what the label says. So, my recommendation to get the safest, cleanest products that are accurate to what the label says is to get it from a medical or a recreational dispensary. You may notice that the medical dispensaries do have a wider variety of products and higher dosaging of products. They also have a pharmacist behind the counter. A medical dispensary is held to the same standards as a pharmacy. So it's access to licensed healthcare professionals. So someone who's really trying to use it medicinally may benefit from all of the resources associated with going to a medical dispensary, but that usually requires having, or that does require having a medical marijuana card. I know you, like I said, you keep hearing that word marijuana. It's just kind of what it became labeled as, even though marijuana incorporates both CBD and THC. So I certainly do have patients that love CBD because it gets their symptoms under control, gets them feeling better, but they can work, they can function, they can think clearly. So they have their medical cards to access to good CBD products. So that's something to consider. I did include in the presentation here a link to the 18 dispensaries in Connecticut at this time. I'm sure more will be popping up. And also, to get a medical marijuana card in any state, you do need to have one of the qualifying medical conditions. These are conditions that the states put on a list that have shown from research benefit from medical marijuana. In Connecticut, there's currently 42 qualifying medical conditions. They include chronic pain, PTSD, fibromyalgia, um, even herpetic lesions. So, a history of shingles that have left you with kind of nerve pain, a wide variety of syndromes. So, I also included a link there so you could see the qualifying medical conditions. Recreational dispensaries are also available. You have to be 21 or older to go in. You do not need a medical card. They're held to the same standards as more of a liquor store. So still have to follow rules and laws, but there's no required training needed to work there at this time. So the people behind the counter are called bud tenders. It's a fun name, and I'm sure many of them have learned a lot along the way and certainly can advise you, but it's not coming from a traditional medical background. If you want that experience, a medical dispensary may be a better fit for you. So this next slide is just a really cool slide that took somebody a long time to put together. So as I mentioned, cannabinoids. There's many cannabinoids in the cannabis plants. We talked about tonight a little bit about THC, mostly CBD, but we are discovering more and more cannabinoids all of the time. Another popular one that's coming up a lot is CBN. And the reason it's becoming popular is because it's known to help with sleep. I have lots of patients who have trouble sleeping, insomnia. They either have trouble falling asleep from racing thoughts or they have trouble staying asleep. They have to get up, they have restless legs, all different things. This can help. So, with this chart, it shows which combination has been shown to work best for the different symptoms and conditions. So, CBD and THC help the best with migraines, cramps, spinal injuries. Let's see, CBG helps the best with glaucoma. Um, what's another one? I'm looking for the CBN. I don't see it here now that I'm looking quick. Anyways, check it out. Very cool. But as you can see, bipolar, OCD, PTSD, epilepsy, Parkinson's, uh, asthma is on the list, fatigue, hypertension. Literally, this plant can help so many symptoms and conditions. I put this slide in just as another kind of different way of showing the locations in the body of the CBD receptors. As you can see, it's pretty much in every system of the body, the endocrine system, which is our pituitary glands, our ovaries, our testes, the heart and circulatory system, the urinary tract system, the reproductive system, like I mentioned, digestion. So when these systems are out of balance, depleted from CBD, they have problems. They could have pain, they could have inflammation, they could have spasms. By getting them in balance, that alleviates a lot of these symptoms and conditions. So we are going to end with another quote. This quote says, "The discovery of the endocannabinoid system, ECS, is the single most important scientific medical discovery since the recognition of sterile technique. As our knowledge expands, we are coming to realize that the ECS is a master control system of virtually all physiology." And that was quoted by a doctor, David Allen. So basically, what it's saying is that physiology, that's moving parts in our body, which is everything from our cells dividing to our tissue growing to our blood flowing. The endocannabinoid system controls all of that. And when it's depleted, something's not going to work right and it's going to make us not feel well. He's comparing this to the discovery of sterile technique, which is when people realize killing germs and sterilizing things before surgery, before procedures prevents death, promotes longevity. That was a huge turning point in medicine when things started becoming sterilized. And this is equally as powerful. So here are those resources that I mentioned. There's two great books that I recommend all of the time to people. The first one is the CBD Patient's Guide to Medicinal Cannabis. That's written by the doctor that I quoted in the beginning of this presentation. The second one is Healing with CBD. It's written by a nurse. Also, very easy read. Both of these books are available inexpensive on Amazon. And then there's a complimentary journal that I put together based off patients' feedback. It kind of helps just kind of keep you on track of the things that you should be focusing on as you're exploring this type of therapy. And last is my references. So I hope that you've enjoyed this presentation. My contact information is in the beginning of the presentation. I am Michelle Valley. You can check out our website, www.advancedtelemedicine.com. We have lots of information and education there. And I'm always happy to have a free consultation with anyone who has any kind of questions. And we also have inexpensive rates if you did want to have a medical exam to see if you qualify for a medical card. So I hope everyone has a great night. Thank you so much for listening.